Welcome to the Dangerously Calm Podcast, episode 2, part 2, with my man Sims Tillerson here. So if you didn't get a chance to watch his the first conversation we had, I highly recommend you go do that. We really just chatted about our own personal backgrounds and struggles with mental health, substance abuse, addiction, the things that we've faced and have overcome through some of the tools and solutions that we're talking about here with mental fitness. And so there's just a lot of really good stuff in there that I'd highly encourage you to go check out. But I wanted to have 2 episodes with Sims just because he's a badass and he's got such a great background and similarity, cut from the same cloth. But from his professional experience, especially in the world of benefits, risk management, that's what we're going to dive into on this conversation. But check out episode 1, kind of get to know both of us a little bit more, and I'm sure you can find some things that we can relate to, and it ties into some of the solutions that we're going to start talking about in this professional side of the house around employee benefits and just overall health and wellness and productivity and performance for organizations. So welcome back.
Thanks, bro.
Yeah, that was good, man. That first one, got a lot of good insight.
We aired a lot of dirty laundry. I think I said 27 fuck words during that one.
That's probably about right. Yeah, right. I always liked you'd said something too in one of your podcasts, because what we do at My Steady Mind, and a lot of times we're not for everybody, and mental fitness training isn't for everybody all the time, and that's okay. But if tattoos and cuss words offend people, then
probably don't want to talk to me.
Probably don't want to talk to Sims. You know what I mean? Probably not your guy, not your flavor. But more importantly, what? Oh, BAMO, our lovely Chelsea over here. So thank you for reminding me. We do like to start with a BAMO breath, and it's never too late, right? So if you don't know what BAMO is, it's breathe and move on. We talked a lot about the power of breath work in the first episode and how simple a breath technique can be to help us regulate. And so we're going to do the BAMO breath real quick. 4 seconds in, 4 seconds out, get us kind of aligned, and then we'll keep jamming out, right? So another BAMO breath.
Let's do it. Good?
Thank you to the lovely co-host over there, Chelsea, that's keeping us on track. So, all right, ready? BAMO. In through the nose, out through the mouth. So good. It's amazing. Works, It's like Sex Panther, where they say 80% of the time it works 60% of the time or something like that. Is that the way it is?
There we go.
So it works. Now are we ready? Can we get serious and talk about
Let's do it.
risk mitigation and employee benefits and the things that we're out here trying to actually solve, okay? But this is also part of it. You can have fun. And when it comes to training and benefits and solutions around safety and mental wellness and the stuff that a lot of organizations out there are trying to improve, I think a lot of people have maybe not known or forgotten that you can have fun.
Absolutely.
And I think it's a big part of the training in the My Steady Mind brand is the training's got to be fun and funny and sticky, and we call it edutainment. Educational, but also entertaining, and then people will do it. And so a lot of what we talk about is that's strategic in getting tools and solutions and resources to your employees that they want to do, right? A lot of the training and stuff out there is stuff nobody wants to do. It feels punitive. It feels like I'm broken and screwed up. And so we'll dive into some of that. But I want to first turn it back over. We got to learn more about your kind of personal side of the house. Now kind of tell me a little bit more about your professional side and where you're at now, what you do with your consulting firm, and then we'll talk about industry trends and how we believe this proactive pre-EAP mental fitness training solution can help really move the needle in from probably both sides of the house, right? Benefits and PNC.
Absolutely.
And so, but tell me a little bit more now about the professional side of the house with Sims, right?
The professional side of the house.
Yes, right.
So I've been in employee benefits for 12, 13 years, something like that. I started my career at a big carrier. We talked about that on the previous episode. And then I got into the startup space and really started learning how do you actually sell when no one gives a shit who you are, which was very powerful for me. So kind of climbed the ranks through sales leadership, had the opportunity to sell a company in there, bounce back to a really big shop, burnout, my best year ever. We talked about that last night.
Then, $13 million in production, but that's when you were like almost suicidal, right?
Yeah, well, not almost.
Yeah, suicidal, literally.
Suicidal. So that was the point where my therapist, anytime I would talk about the big numbers I would put up, the only thing she would say back to me was, "Doesn't matter if you're dead."
Yeah.
So left that big company, helped scale an early stage actuarial consulting and software startup, worked myself out of a job, and became an independent consultant about a year and a half ago.
Okay, and that's Tillirson Consulting.
Tillirson Consulting
right?
Group.
Yep.
So what I do at Tillirson Consulting Group is I help great vendors in the insurance space grow and reach more people, and then I help brokers on the P&C side and benefit side reach their ideal prospects faster by being exactly who they are.
Yeah, I love it. I love it. And it was great to get to meet you as a my steady mind and an entrepreneur, and bringing a new solution. Like, that's what we're trying to do. How do we help as many people as possible? And how do we bring this new solution of scalable operational mental fitness training to market, and do it in a meaningful, strategic way, because it's an approach, and it's something that's new to the industry, all industry. And so it's helping to educate and inform to potential people out there, and then demonstrate the effectiveness. And that's what we've done as a company. We've proven at scale what can happen when you bring a solution like proactive mental fitness into an organization. We're also learning out there, and that's what I want to talk a lot about, like what you're seeing in the industry that's not working.
Yeah.
What some of the hang-ups might be, and what some of the challenges that might be for the solution we're bringing in, right? Like, people there's still stigma and misperception. And so just really talking about, because if you watched episode 1, and I'll kind of bring it back up, because I think it's really important for people out there watching this to understand, like, what we're trying to solve. And you and I talked about our backgrounds and our challenges and our struggles with substance abuse, alcohol, drugs, just anxiety, depression, all the stuff that we've struggled with as individuals and men, and as dad, and working in industries and organizations. And a lot of the industries and organizations we worked in have never really had a solution,
right,
that helps us, and I've been, an employee that has a traditional EAP, and have tried to use it, and I didn't like some of the stuff that was in there was either antiquated or just didn't work, and that's why they have such a low utilization rate. And so trying to say, how can we, not saying you abandon EAPs, but just we need more proactive pre-EAP stuff that meets people where they're at with all their fuck ups and their hang ups and their challenges. Because that's stuff the company can't fix.
Right.
I can't fix what's going on in the house, or your childhood trauma, but we just need to make sure, if you're a forward-thinking organization or company out there, that you're bringing the right tools and solutions in,
right,
no matter where people are in their personal journey, So, yeah, let's just kind of talk about what you've seen in the landscape of benefits and traditional offerings, and kind of, you've also been doing it, what I like, kind of like pre-COVID, post-COVID, and the change, and so just walk me through kind of things that you've seen in that space, and then we'll start talking about how we can make some progress and improve some of these numbers and things that, whether it's healthcare claims or the stuff that carriers are really trying to solve. So just talk me through kind of your evolution of being in that space, what you've seen pre-COVID, what's happening.
Yeah.
We'll
so
jam out.
I'll break it down, healthcare as a whole, and then mental health. So healthcare as a whole, basically, since employer-sponsored healthcare began being offered, costs have risen steadily. They're going to be the highest they've ever been this year. So what most employers care about is, how do you bring that number down? How do you bring my health insurance costs down? A lot of what we're doing is focusing on what we call high-cost claimants, which is a good thing. So musculoskeletal claims, very expensive infusion drugs, we're focusing on those things. But one of the things that really bothers me about our approach is that we're very reactive still, right? Not just on the mental health side, but on the physical health side.
Sure, everything.
So let's pull it back, go back to mental health. Before COVID, nobody gave a shit about mental health, right?
Especially proactive. I mean,
no.
As an entrepreneur out there trying to do, people looked at me like I had 3 heads.
Oh, I'm
like,
sure, man.
You're like, you mean proactive mental training? What do you, we've got a therapist. I'm like, no,
right.
That's okay. Never mind.
Right.
But yeah, nobody knew what it was or gave a shit.
No.
You know?
So, but during COVID, you know, I don't know if it's true mental illness or people's perception of their own mental illness, but this problem got amplified pretty significantly. People that had never dealt with anxiety before start dealing with anxiety. Maybe because we're locked in our fucking houses and we can't
And
hang
they're
out with
shoving
people.
fear down our
Yeah.
throat. Sensationalism.
Maybe because of that.
The death counter on the screen every day, you know, like, oh God. Like,
But what that did is it opened up the pocketbooks of companies for their benefits packages because they started going, shit, all of our people are struggling. We got to do something. So that led to human resources teams, finance teams green-lighting all this dumb bullshit that doesn't work.
right.
Right? All these vendors promise ROI. None of them
Can prove it.
None of them can prove
Right.
it. And so what happened when we came out of COVID is spending got very restricted because CFOs started to go, wow, we're spending $15 per employee per month on all these solutions nobody uses. So that's the place we're in now. We've reached kind of a fever pitch with rising costs, but no one's willing to greenlight solutions unless we have proven return on investment. And for mental health organization, that's a very scary place to be, because when we think about being upstream of the actual claim, you know, depression is an independent risk factor for heart disease. Depression and anxiety affect how diabetes patients take their medicines, how they adhere to protocols, right? It affects all these high-cost claimant categories. But when we talk about mental health, at least from a benefits perspective, we talk about it in a fluffy way. We're going to reduce absenteeism. We're going to make your people pay more attention at work. All this stuff that a CFO looks at and goes, great. How does that help the bottom line of my business? So our challenge today is, how do we pull the red thread from preventative mental health to, hey, you're going to prevent the suicide claim. You're going to prevent the substance abuse claim. You're going to prevent the mental health leave, and we can talk about that big stat in a second. But you're also going to improve performance in a lot of your high-cost claimant categories when your people are happier.
Right, right. You know, and that's what I want us to dive into, because that's the stuff that we as a company within My Steady Mind have been understanding, following, studying, you know, basically for the last 4 years to learn what's going on, what's working, what's not working, and then continue to build our solution in a way that mitigates a lot of those, you know, kind of false claims and stuff, you know, just overcomes a lot of those barriers that people have, rightfully so, like a CFO who,
Sure,
you know, like, you should get a good ROI on what your thing is. And everybody, whether you care or not about your health and happiness of people, like everybody generally does, right? But if I'm spending, you know, from a business, people are going to look at that, you know, what's the actual data-driven ROI on that? And a big part of what we'll talk about with mental fitness training and our approach is, you know, you have to understand before even all of that, and that's where a lot of, like, my background as a mental performance coach and sports psychologist, you have to understand human behavior, right? And you have to understand that behavior change takes time, and you have to be very strategic about how you get people to change things that they may not want to change or may not know that they're doing wrong, right? And that's where our solution, and we call it hiding the medicine in the cheese, right? That's what mental fitness and My Steady Mind is we know everybody in every, I don't care what industry you're in. I've been in them all: law enforcement, healthcare, finance, insurance, aerospace, defense. It does not matter. If you've got a brain in our country, it's unsteady, right? Because of everything that we've gone through. And so that's just the reality of the situation. And you have to meet people where they're at with solutions that are fun, easy to, you know, don't make me feel like I'm screwed up, don't feel punitive. Because that's why people, like you said, they don't want to do it. Nobody wants to do this reactive stuff that makes me feel. And so we've, you know, taken that into consideration, and we'll get into, I'm sure, talking about some of the case studies and the things that we've been able to show that we can actually, and we can show statistically, you know, the ROI on it and how we have mitigated suicides. But we didn't sell it as an anti-suicide program.
Sure.
You sell it as a high-performance mental fitness, and people will lean in, and it works quick, and it's fun, and it's funny. And then you just start to see the things that you're trying to mitigate happen. But, you know, back to what's been going on out there in this evolution of organizations and industries, like that's the one thing like. People have been trying things,
Absolutely.
right? And that's great, you know. And so I'm not throwing shade on. I'm just saying there's a lot of bullshit out there.
There is.
And a lot of stuff that doesn't have any substance, doesn't have any legitimacy, doesn't have any measurability,
Mm-hmm.
you know. And that's what I try to run around. It's like, look, like, just take a look at what we're doing.
Yeah.
Right? And look at what you've been doing. How's it working? What's not, you know? But we can talk about like what we're seeing from a actual HR perspective,
Mm-hmm.
you know, claims, costs, all the stuff, like you said, it's just going up. And the one thing I can tell everybody out there again is it's not going to get any better
No.
if you don't do anything about it, because of the world we live in and just the general stress and unsteadiness and AI and all the stuff that's coming in that's making people feel distracted and scared and worried and anxious and depressed, that's driving healthcare costs, increasing incidents and accidents. It's not going to get better anytime soon.
Absolutely.
And so you need to make sure you're doing the right thing. So yeah, just talk to me a little bit more about.
Yeah. Let's talk about what's out there right now.
Right.
Most companies in their benefits package, they offer an EAP or an enhanced EAP, and then the ones that really want to do it up, they offer that, and then they offer a meditation app or something, right? What's the problem with these two things? Problem with the meditation app, you have to know you need to fucking meditate to use a meditation app. I do meditate. I won't use a meditation app. It's not for me, right?
Me either.
It's not for me. Then we talked about this yesterday, this idea that I think the stat used was 23% came out of NAMI, right? That 23% of people in our country have a diagnosed or undiagnosed mental illness. Those are the people that can use an EAP.
That need an EAP.
Right.
The treatment, the
Absolutely.
therapy, the medication, 100%.
What the fuck are you doing for the other 77% of your employees? The answer is nothing. You might think you're doing something, but again, the 77% of employees that are not plagued by a mental illness, they don't think they're sick because they're not.
No.
Right? So
They're struggling with life stuff.
Sure.
The divorce,
but they don't
the
want
breakup, right.
They don't want something made for sick people,
Yeah.
right? But they also, think about a guy my age working in construction who hadn't been through all the shit that I've been through, but maybe my old lady left me.
Mm-hmm.
I'm not gonna go to a meditation app. I'm not gonna call the EAP. What am I gonna do?
Right.
And you know what I'm gonna do.
Oh, I know.
I'm gonna be distracted, and I'm gonna fuck something up.
Right. I'm going to hit somebody with the forklift. I'm going to drop because I'm time traveling in my brain. And that's where I want to talk about a couple of things you said there, too. Because a big part of what I talk about and what we teach and really what separates what we do at My State is like nothing I'm talking about is just my opinion, right?
Right.
We're not just speculating. A lot of, we're studying and following the trends and looking at the research to make sure we're helping people understand just the reality of what's happening, right? And so that NAMI, which you talked about, the National Alliance of Mental Illness, that's the OG governing body of mental health in our country, and they kind of set the gold standard for what's happening, and they keep their finger on the pulse of what's happening. And every year they do that a study survey that just tells them they're trying to figure out what percentage of the U.S. adult population either has a mental illness or has kind of an undiagnosed.
Yeah.
And again, there's nothing wrong with having a mental illness, just like there's nothing wrong with having physical illness. I've had multiple mental illnesses, and so it's not throwing shade or saying people, no, it's just understanding, back to your point, a numbers thing.
Yeah.
Right? So knowing that, if I have a company with 1,000 employees in it, assuming it's all adults, right? Whether it's, let's use a construction company. If I own a big GC, I'm a general contractor or whatever, and I got 1,000 employees, based on this fact, 23% of my population has some kind of mental illness, diagnosed or undiagnosed. That means that, what is that? 230 people.
Look, we can do math.
We said we weren't math people. I didn't have to break my phone out, so that's why I used a good round number. But what that means, again, if you're thinking about it, it means if I've got 1,000 employees, I know generally based on what NAMI's telling me, and the number's getting higher, right? And this is also why it's so important what we're talking about. We have not even scratched the surface on how fucked up mental health is going to be as a result of COVID.
Yeah.
Right? We have not even scratched the surface on what that's going to do to our society and people mentally, as how that was handled, and the fear and the worry and the isolation. And so, like, this is national epidemic stuff in my mind, right? That's why I run around like my ass is on fire trying to educate, right? And say, look, do something. but let us help you do it. Anyway, so basically, 1,000 people in my company, 23% have some kind of mental illness, diagnosed or undiagnosed. They need treatment.
Yep.
They need medication. They need therapy. They need counseling. They need those resources that most of us have. And I've used them all,
Sure.
right? But what that also means is 77% of your company don't, right? They're just going through the general daily just existence, right? The wife's leaving me, I'm struggling with my worries and my just general stuff. They just need some tools, right? Mental fitness, some training that can meet them where they're at to teach them how to just take a breath or how to reframe those thoughts, and that's where when you're a company, and that's what we're trying to talk about with this solution of having, you want to have your EAP with your resources for people that are dealing with hard stuff. And then our approach with My Steady Mind is what we call a pre-EAP, and that's where you want to have mental fitness training that is accessible to anybody. If I'm that 21-year-old, foreman out there and my, wife's leaving me and I'm struggling with my finances, right? He's not going to go, hey, the company offers the, Calm app. Let me just go download that. And if I start meditating, my problems will go away. They're more than likely not going to use that. And they don't need that, but if they see that, okay, there's a mental fitness course that, is one, I can do it on my lunch break and it's going to give me some tips and techniques that's going to help me be a better foreman. It's going to improve my, that's the wink, which it will, it's grounded in performance training. It's going to help you be a better plumber, carpenter, engineer, athlete, because it will improve it. But you're learning simple techniques to just manage your stress. And so that's what we're trying to say is you've got all these challenges and barriers that are happening out there. It's getting the right people in the right thing.
Absolutely. And I think something that we haven't talked about, and I'm going to back it up with a stat here in a second, is that 21-year-old foreman you talked about who's not going to use the meditation app, but also isn't ready for clinical intervention. They're, unfortunately, in all likelihood, they're going to get to a place where they have to have clinical intervention.
Right. Because they're going to keep suppressing, they're going to keep doing things that's going to end up in a blow up or a breakdown, right? And that's where it's, again, when everything is grounded in this reactivity, that's why the costs are so expensive.
Right.
And I use law enforcement a lot. So when law enforcement, we work with a lot of law enforcement, and one of the things that they said about mental fitness training, the secret is you have to get the training left of bang. Left of bang, right? And what that means is they know in law enforcement that day one, when a candidate comes into your academy and starts going through the training and then starts their career as a trooper, there's going to be a bang. You don't know if it's the first week of the job or it might be the 23rd year. It could be a partner gets killed. They have to take somebody out. There is a suicide. And so we wait in industry for the bang, and then we shove into treatment. Right. And that's where costs and things just go exponential. And so we're saying you can't, right? Get some stuff proactive, and that's where, again, the mental fitness stuff is you have to make it very simple, and something he can do. He can scan a barcode and do it in his truck on a lunch break and learn BAMO.
Right.
Just if he learns BAMO, that might be the one technique that helps him get through that day, right? And he does it a couple days, and after a week of doing it, it might be the thing where he's starting to kind of get a little more regulated, and now he might be like, hey, let me ask for this next level of help, right? And that little intervention that you put downstream is the thing that's going to mitigate potentially that upstream thing, and so it's just, it really just, I think in the benefits, there's not been much proactive solutions that work at scale, right? I'll say this too, and then I'll shut up because I see a lot of it is, she's laughing. She's like, he won't shut up. No, he won't. She's probably right. Maybe you can edit me, shut me up.
No chance for either of us, man.
Yeah, you got two talkers here, right? That's why we have to have a timer going because we'll go all damn day. You got a flight to catch. But it's what companies and organizations do, and this is what I can't stand that pisses me off as a guy that's out there trying to actually help people make a decision to bring this into their organization. But I give them a pass because they just don't know. It's a whole new thing. Right?
It is.
But companies they'll understand, okay, no, we're trying to improve culture and we're trying to help people out. We brought a motivational speaker in last year. We brought John Doe in, and he talked about that's not training.
Yeah.
That's a dude talking for 1 hour, and that people might be motivated for 60 minutes. But that's not, and so they're doing, when it comes to proactive stuff, it's these little one-off things that they do that they think, well, we did that, we brought in, and I'm like, that's not proactive training, and so we'll talk more about, and that's what My Study Mine we've created, and as you know, is a scalable solution. It's not just Seth coming in and doing because that's what people that I've worked with, like I'll come in and I'll do a 3-hour paused when pissed workshop or a 1-hour speaking engagement, and they think that's the training. And I'm like, no, that's just me telling you about it.
Yeah.
You've got to do this whole back end thing that you can bring in if you want to. And we've got case studies that show when you do that, you can mitigate incidents and accidents. And so I'll shut up now because I'll get on a rant. 'Cause
I love it.
Yeah, you know what I mean? I just want to grab people by the ears and be like, no, you're not seeing it.
I do. Because I feel the same way. So we talked about all this shit that people are trying, right?
They're trying. Thank God you're trying.
So, but let's talk about this. So all these organizations have these tools. I read a study yesterday. It was by Spring Health, and they're one of the, they're a big enhanced EAP. But this is a great stat. They interviewed HR leaders at companies with 500 or more employees. 61% of them said mental health leaves in their company increased this year versus last year. More people are going out on mental health leave. That shit is expensive. Right?
When a person's out.
Yeah.
Right? I mean, it's costly. Yeah.
It's costly because it's going to it depends on how it happens, but it's probably going to hit a disability claim that's going to be expensive. You're going to be down manpower, right? Mm-hmm. Then you got to decide, am I going to pay to fill that while they're gone? Is the person ever even going to come back? How did we let them get there in the first place? And I'm not saying we can mitigate mental health leave 100%.
No.
Of course we can't. We need the clinical resources, but I do not believe in my heart of hearts that everybody that gets to that point had to get to that point.
Right. And that's where, again, it's like understanding, and I'm all for having a policy that allows for some kind of mental health leave.
Sure.
Like, it's not knocking that, and it's just, again, thinking about, are people abusing it? One, could be, potentially, right? Are people taking it that shouldn't be, or is it, what's the total cost that people are using it? And then, again, we're just seeing it getting used. Is it a good thing? Is it a bad thing? And I think some people could say, oh, it's a good thing because more people are aware to take the time off, but then as a company may look at it and say, no, it's a bad thing because all this lost time, lost productivity and whatever. And you're trying to find that kind of middle balance. But even with that, to me, and this is what I say, when that person is on mental health leave, what are they doing? Are they just taking the day off and sitting at home and stewing in their shit? Because that's where, again, if I'm running a company and I have a policy that has some mental health leave, I want to be able to say, hey, if you're struggling with something, maybe you lost a relative or whatever, and we have this mental health leave policy, you can take this mental health leave, but while you're on it, do the mental fitness foundations course, right? Because it'll help you with, don't just go home and, and that's, I would just wonder, like, how can you leverage training that's going to help them work on something as opposed to just not coming to work.
Yeah.
Right. Because just not coming to work is not going to fix your mental health.
Right.
It's just you're just not going to, it's going to maybe help for a day or two, again, which might be good, but you're not fixing the problem. So what other things have you, seen in that companies might be doing, or, some of the costs, because we'll get it, a big part of the risk mitigation thing that we're solving with, because at My Study Mine too, like I tell people, and I know, we're not a mental health company, we're not a mindfulness company, we're not a meditation company. We're really high performance risk mitigation, by using tools to mitigate distraction and frustration, which is where most incidents and accidents happen. People are distracted and they're pissed off.
Yeah.
And that's when you look at any claims, I would imagine when you go look at claims, most of them are directly related to, it wasn't the company was bad, or the person was stupid or didn't know their job or wanted to get their hand cut off. It wasn't that the company didn't have good SOPs in place or good training in place. It was just that person showed up and they were on the job site and they were distracted either on their phone or in their mind thinking about they're not going to make rent this month, or my wife is about to leave me, or they're frustrated because the materials were late or the schedule changed and they pushed the wrong button. They, didn't harness their thing. And that's what happens. And that's what causes the incident or the accident. And then everybody scrambles out, well, what happened? And they've never been able to really diagnose that mental lapse, And so then the organization is like, we need to rewrite SOPs.
Yeah.
And that creates more frustration and confusion, right? Or we need to go buy new gloves. And they spend $500,000 on gloves. And it's like, neither one of those were the problem, right? You're doing some reactive solution that creates more. The problem was the dude didn't know how to take a breath in the forklift because he
Yeah.
was mad. And so
Yeah.
anyway, that's what I've seen as I've come into this space, and that's the root cause of most things. At home too, right?
Yeah.
You get frustrated with your kids, your wife, your husband. You get distracted driving, and so it's not the company's fault. It's the world we live in.
It is.
And that's where you have to have real forward-thinking, innovative, practical solutions that meet people where they're at and make it simple and easy to do. And that's not how most companies have their benefits plans.
No, it's not. And it's been really interesting as I've gotten to know you and my study mind. Like what I'm watching most companies on the benefit side do is go deeper into an enhanced EAP, because a lot of these enhanced EAP
So
providers.
tell me a little bit more, sorry, about just there's EAP. And for people that may not
Yeah,
know, too,
yeah.
just kind of what an enhanced EAP is.
Yeah. So your EAP is the
Employee assistance program.
Yeah, and it's the thing that's inside of your group life or group disability program that you get offered. Your employer pays for it for you. You may get 3 to 5 visits with a therapist, financial wellness counselor, whatever it is. It's meant for
Smoking cessation.
Yeah,
that
it's
kind of
meant
stuff.
for crisis. You're meant to use it for a very short period of time. And they're riddled with lots of problems that prevent access. So these enhanced EAPs are considerably more robust, typically provide way more access to clinical help, and a lot of them are building preventative measures. But the important thing for us to remember with all these enhanced EAPs is even when they get preventative, they are clinical solutions, right?
Still grounded in treatment.
They're grounded in treatment, and that's important for us to recognize. So we've got all these companies going deeper there, and what you'll see is instead of the average 3 to 5% utilization we see with an EAP, they may get to 10% utilization or maybe even 20. But to our earlier discussions, they're not the fit for everybody because they're a clinical product. So what's been interesting to me getting to know you and my steady mind is that you guys are selling through fucking safety directors at construction companies. But like obviously I've taken a look at the data, and for them it's a lot more clean cut. If a safety manager can bring you in and pay, $50,000 for a training with you, if they mitigate one reportable incident, it paid for itself.
Right. And that's what, we've done, and what we're trying to help is like my job, as the CEO and trying to get the solution into industry and into market, is who's listening, right? Who and make it, simple. Like, until we get to the point where we're eventually going to get where this becomes like carrier provided or backed, which we're working on some partnerships and things like that, right? You have to come in and that's what I look at. I'm like, okay, what do you give a shit about, right? And most, especially construction, we've been working in the construction space a lot. I don't come from that industry. I've learned a lot in the last couple of years because they do give a shit about safety, right? Because that's where their costs go, right? And that's what they care about. People can talk about mental health, and that's like, it's just this kind of like, but if I come in and I'm like, okay, how much did you guys spend in incidents and accidents last year, right? What were your costs, your IRs, these recordable incident rates, and the things that's what they are just they're always trying to lower these, right? The RIR, recordable incident rate, and there's other numbers too. And that's what we've been able to show is and again, like if you can bring some mental fitness training in and get it deployed out into the job site, and again, the thing is our training is just, you talked about what's EAP is 3 to 5% typical utilization.
Yeah.
We have an 88% adherence and completion, right? People want to do our training. And that's what I talk about, like in construction and stuff, when it comes to mental health or safety training. There's some good training out there that provides useful. Nobody wants to do it. Yeah. It's the most boring shit. You're talking to me like I'm an idiot. It's grounded in clinical work, or it's some therapy. And so just, not that it's just, you have to understand your user.
Yeah, you do.
Right? And if they don't believe in it or trust, or if you're trying to talk down, they're not going to do it. They're going to go the opposite way, and a lot of times do the opposite. And I've seen that happen with safety training, And we did focus group. None of this, like everything we're doing, the solution is not just, let's see what happens, right? I did focus groups with foremen and superintendents, and I was like, what's the problem? What's the challenge? How can we help? How do we package and position this so that, and that's what they said. They're like, look, if it looks like another safety training, we ain't doing it. If it looks like it's mental health, we ain't showing up, or we're going to be half asleep, right? And so it's got to make us feel like it's about improving our performance, making us a better plumber, electric, whatever. which is what sport this is. This is performance training at its essence. You know, the best athletes, the SEALs, the people I train that do mental fitness training, the tip of the spear performers, that's why they're tip of the spear, because they train mentally. That's just never been available to you, ever.
Yeah.
You know, now there's bullshit, fake stuff all over the internet, life coaching and stuff out there that people will think is it. This ain't that. This is progressive training that will rewire your brain through neuroplasticity if you put in the work, and it will make you a better at your job, whether it's sales or whatever the case is. But more importantly, it's just going to help you deal with your stress at home and at work, which is going to make you show up, need less mental health leave or need less medication or all the stuff that you're trying to. So you have to understand the customer. You have to understand how to motivate them, and then you have to meet them where they're at, eliminate the barriers. You know, they don't have to go sit on a couch. They don't have to, you know, tap into insurance. There's a bunch of ways you get around that. So, and then when you bring it to them, they love it. And this is what I've been able to see is then they're like, hey, can my son do this? Can my wife do this? You know, and that's when you know you're in. And that's, if I'm running a company, I want my people to be grateful and happy and healthy and help their households.
Absolutely.
Because that what's going on in the house shows up on the job site. You know, and that's what's cool about my steady mind and our approach is we've got solutions, whether it's for kids, mental fitness for kids, ways to just help that employee just show up healthier, happier, regardless of the shit they're dealing with. You know, and if you can help one person go out there and you know, take that one Bammo breath before they fire up the forklift, you just saved your company $2 million in claims, right? And so, and we've been able to show, you know, about a 25% reduction in RIRs and things like that.
That's pretty incredible, man.
Yeah, I mean, for a minimal spend and a maximum return.
Yeah.
But you have to do it.
And
it's not a one-off thing. It's got to be, the term we use, it has to be operationalized. You know, and the cool thing about mental fitness, again, it's just tips. It's not a heavy lift. You know, we've made it a plug-and-play solution, and that's what we're trying to do.
Right, and it's just like, I mean?
It's not
giving people little tools that they can pull out in moments.
Yeah, right. And we have a train the trainer model, you know, so you can certify people, your safety pros, your leaders, whoever, that can reinforce the training and deploy our ecosystem of products. And now you've got like the comprehensive solution. You're bringing mental fitness into your organization, not in a one-off way, you know, and that's, I mean, I'll talk to you about this too. I think you've probably seen it. Maybe, I don't know if it's a benefit side, but we've been able to show also from a recruiting and retention standpoint how important having proactive mental solutions is, because the generation that's coming up, right, the millennials and Gen Alpha, like they're the first generation in the history of our country to see mental health as health, and they want to proactively work on it, right? Like, and that's a seismic shift, you know. And so for organizations that don't have proactive mental training solutions, you're a dinosaur.
Yeah.
You're a dinosaur. They're not going to come work for you if you just say, oh, we got a suicide hotline and a EAP. They're like, that's it?
Yeah. Yeah.
So what have you seen, you know, in that space, just with trends or from a recruitment retention?
I mean, I think that when I've recruited people over the past couple of years, and when I help companies that are in recruitment, those benefits packages are important, and we're not necessarily looking at major medical like maybe boomers and Gen Xers were, right? We want a lot more, and I think that the trend with the younger generations is that we talked a lot about work-life balance and shit like that during COVID, but the younger generations, I don't think they really believe in that. They believe in a really like blended, harmonized approach, which is what I believe in too, right?
100%.
Like last night, me and you chopped it up for like 3 hours and fucked around and had a great time. And when I got back to my hotel room, I worked for a little while, right?
Right.
Right. And I'm not preaching that working at 9 o'clock at night is healthy, but I like being able to just kind of weave in and out. And you need benefits like this that help people in their lives totally, not just when I'm at work.
Yeah, and I want to talk about that because it's so important to help people understand, like, because I hate the term work-life balance, right, for a multitude of reasons. it's one of those easy turns. It's easy to say, right?
Yeah.
Oh, it's easy. Oh, work-life balance. We care about work-life balance. Shut up, right? Because what work-life balance does, again, to most of the workers, is it sets them up for failure because they think I should be able to leave work at work and home at home, right? And so they just think I should be able to just shut work off, go home, be a dad, be present, and that's not all of it is. It's always a part of who you are.
It is
like so. The whole thing, and essentially the name of my company is My Steady Mind. I just want you to be balanced. I don't give a shit where you're at.
Yep.
If you're with your kids, I want you to be balanced. If you're on the job site, balanced. So it's not this like I have to be this here and this here, because that's unattainable.
Yeah.
And then that's where people beat themselves up, and why can't I have this balance? Why can't? Because you never can, right? And so that's what the younger generation is now understanding. And again, it comes back to, we talked about being Buddhist, right?
Yeah.
The middle way. That's where life is. It's in this middle, not too high, not too low, having both things, kind of keeping me equanimity, right? And that is, I can't just walk into a team meeting and be like, hey, everybody, let's have some work-life balance out there. And then the team meeting's adjourned and everybody leaves and has a balanced life.
Yeah.
I can't put a fucking poster on the wall that's like shows somebody on a, that's not training. That's just talking. I have to teach them, and I have to give them tools to learn how to just be balanced, just be, right? And that's where, like, learning how to just sit and be still and be present and use breath techniques. And when you start practicing these things, you start conditioning your brain and your body to just be steadier, right? Regardless of what goes down. And that's the ultimate goal, we can talk about it till we're blue in the face. And that's what a lot of people you'll see, especially coming out of May, which was Mental Health Awareness Month, and we'll talk about that. Like, everybody in May comes out of the woodwork, right?
Yeah.
And everybody's a fucking champion for mental health in May, but all they're doing is glamorizing the problem.
Yeah.
Because it's easy to talk about the problem.
It is.
Anybody can talk about statistics and pull up the data, and people think that that's going to really improve mental health, and it doesn't. It can actually backfire, because the more we talk about a problem, then it starts to plant seeds that, well, am I suicidal? Am I, so it's like what we're doing, and I think, and I'll kind of talk about it, what we're doing at My Steady Mind, and a part of this initiative is saying, keep May Mental Health Awareness Month. Do you know how long May has been Mental Health Awareness Month, out of curiosity?
I don't.
Right? Do you, Chelsea? How long has May been Mental Health Awareness Month? So most people think Mental Health Awareness Month was like something that came from COVID, right? Like now it's 75 years old.
That's crazy.
Yeah, May was designated Mental Health Awareness Month in like 1942, after one of the world wars, right? Whatever it was, too, or whatever. And so Mental Health Awareness Month has been around for a long time, right? We've been talking about it for 75 years.
Yeah.
And now the talking has got escalated. And I'm not saying quit talking about it, but what I'm saying is you can't just talk about it for a month and then it's crickets the next 11 months. And that's where mental fitness, and we say June is Mental Fitness Training Month. So that's what we're trying to help people and organizations and industries understand, is how do we bring a solution into the market that gives people tools for all 12 months to proactively work on their mental fitness, just like they could their physical fitness. And then if shit hits the fan or something goes sideways, you do have the tools that they can go get the more escalated treatment, And so it's just, and that's why we're doing this it's because we really have to educate people. It's not that people are dumb or leaders are making stupid decisions. They don't know. They don't know, right? And that's where I see is, like, back to your point, they'll be like, we're trying things. We spent $100,000 on some wellness initiative last year, and nobody used it, and nobody did this and that, and so we're not going to do it.
Yeah.
And I'm like, well, that was a solution, right? Let's try this one.
Yeah.
I
think it's going to be interesting to watch, because, like, the reason that I talked about the idea that mental health is not going to be fixed by benefits leaders, at least in the early stage, is going to be it's going to be fixed by union leaders and safety managers that bring in mental fitness training for a different reason. But it's only like 2 or 3 years ago that direct primary care on the benefit side, which I talked to you about last night, was this crazy concept. And now all these people are using it. And the idea is, I have a direct primary care doctor. I pay her $100 a month, whether I see her 0 times or 30 times.
Right.
She is incented to spend a lot of time with me whenever I need her, but she's also incented to keep me healthy, right? And for companies that bring in things like that, you see it in your claims data because you have lower claims because people are investing in prevention. And in a couple of years, this crazy idea of mental fitness training, that's going to be the same damn thing. People are going to go, why the fuck hadn't we been doing this forever?
I know, yeah, right. And that's the main. We're trying to tell people, and the reason we're doing a lot of this is and that's what I like. The good news is change is coming.
Yeah.
Right. And that's what I see. And I see, I work with some of the more forward-thinking, innovative leaders and organizations out there, and we're still figuring it out. Right. That's why we work with how do we solve this problem in a big way at scale? Because we're all trying to do the same thing. We're just trying to help people. Right. We're trying to help people be healthier, happier, improve performance and productivity, and organizations reduce costs and spending. And the shift is, that's actually the term in the industry, is there's this paradigm shift in the way a society thinks and acts and behaves. And we in North America mostly have been grounded and by design on reactivity, and not fixing the problems proactive. And we can save another hour of a podcast to talk about the design of why all this is happening and really kind of some of the darker side of the system that we're up against, but ultimately that's what happens. It's like mental fitness training is one of those things where it's like nobody knows they need it. They've never heard of it. And then once you get it and you start doing it, you're like, how the hell have I lived without this? Right. And I can't imagine my life without it. But it's our challenge is getting it into industries, overcoming the stigma. Because I'll see this a lot too. I'll come and I'll talk to a leader that'll hear me on a podcast or hear me somewhere, and I'll start to talk about what we do with mental fitness, and they'll be like, "Oh, we already do that." They're like, "Oh, so you already do it? Like, what do you do?" And they'll be like, "Well, we have a therapist that comes in on Tuesdays from 3 to 4," and I'm like, "Okay, that's cool. That is not mental fitness training, right? Like, that's good. That's better than nothing." And so, but they think like or they'll be like, "Oh no, we already do that. We have everybody has access to the Calm app." I'm like, "Okay, that's streaming. Okay, that's great. That's not training." And so it's just like I have to be like, I have this curse of institutional knowledge because of what I've done and what I've seen and the people I've worked with. And so it's educating people in a way that's like, okay, look, I'm glad you're doing that. That's great, but this isn't that. But let me show you how to. And then the other thing where they get hung up sometimes is they start hearing about this solution, and they think, oh man, we don't have time. We don't have time to integrate that. That's going to be a massive lift. It's going to require all this extra because everybody's busy, right? But it's like, no, this is a simple plug and play. We have train the trainer model. We have a way that we can make it integrated, minimally disruptive, minimal time, at scale. And so it's just, finding the people that understand it, that see it, that are forward thinking, that are innovative, that can start to help bring it out there, and we'll track all the data. We'll show, we prove our, everything we talk about, we can prove through real case studies. We've got case studies that have shown, Virginia State Police that has integrated this, over a 2-year period, 50% reduction in suicidal ideation and no suicides, right? And then what happened? They pulled it because everything was fixed, and 3 months later, an officer kills himself, right? And that's a cut and dry case of saying, okay, you spent $50,000 annually on some proactive mental fitness, reduced suicidal ideation by 50%, had no suicides, pulled it because a new change in leadership was looking at trimming, and then you have a successful. And then now, how much? And how much did that suicide cost?
Yeah, and the answer is
millions. The real cost, indirect cost. So that's clear cut, and then reduced incidents, with McKinney's big GC out of Atlanta, 2 years rolling it out, 25% reduction in RIRs. How much is that worth? A 25% reduction in recordable incidents.
I mean, I would love to see the number.
Yeah,
but
right? It's
hefty.
probably big. It's probably hefty, And so it's just, it works if you do it. The most expensive thing you can do is nothing. I tell that to people all the time, and if you don't want to do it, don't do it. But in 3 years from now, I'm going to come back and be like, hey, how's it going? Let's look at your claims data, right? Oh, and so.
Well, I think one of the interesting things you do that you don't talk about enough is that you're like, shit, if it doesn't work, I'll give you your money back.
I will, yeah. I've done that. Money back guarantee. If this doesn't work or you I've done that before with people. If you don't think this,
But how many times have you had to give somebody their money back?
Zero. Yeah. Zero. Because we're not selling bullshit. Like most people out there are selling shit. They're good at marketing and telling you, and it just doesn't work. And again, I'm not saying My Steady Mind and what we do is the only solution. I mean, we're a tool. It's just people need to think about bringing this tool into your ecosystem and
people need to be really thoughtful and discerning when they bring in any new solution to go look under the hood and say, how many people actually use this? Right. What are the results look like, right?
Yeah. And that's a big thing that I love that you said about that, because when it comes to a lot of the mental training out there, whatever, it's just still very ambiguous. Not that it's bad, but there's just no kind of clear-cut direction or what's the outcome.
Right.
And all of our training it's measurable, right? It's the 12 stars of mental fitness. Everybody's going to know what the learning objectives are. It's going to create, this is something I do want to talk about that's a big part of what we've done that is actually what really moves the needle in organizations is creating the shared language, right? And so when it comes to all of these industries, so most of the industries we work in we call them VUCA, right? So an industry that's volatile, uncertain, complex, and ambiguous. So high stress, high risk, millions, billions on the line, life on, like, My Steady Mind is not for people that can't get off the couch. If you're not a self-starter, you're not, like, you want to make it available. If I'm a benefits provider, like, you don't want to leave people out, but we have no expectation that everybody's going to do it, But if you can get it to the 20%ers, that are the ones that are really moving the needle, that carry that's who's going to do it, and that will change everything around it. But those industries, those VUCA environments, the thing that is lacking that creates a lot of this stuff is there's never been a shared language really that lets people talk about stress and emotions in a way that doesn't feel like we're talking about stress and emotions, and that's what you can put people. You can go to a job site or construction company and put people through some of these trainings out there that are geared more towards, anti-suicide program, and they're great training, right? But that foreman is never going to go back out on the job site and feel comfortable talking to his fellow person using that language, right? So they just don't, for the most part.
Yep.
So a big part of what we at My Steady Mind, and this is the human behavior and the hiding of medicine in the cheese, is you have to create a language like BAMO, right? Breathe and move on. All of our stars, something they always remember. So all of our training teaches stars, 12 stars of mental fitness, and that creates the language where I can walk up to somebody and be like, hey man, it seemed like you're time traveling out there. Let's embrace the suck. You want to go do a BAMO breath? Right? And they communicated in a way that's saying, hey, I can see you're struggling. Let's go do something. But it wasn't like, hey man, come on, just take a breath. Like, you take a breath, asshole.
Yeah.
Like, you go home and tell your wife to take a breath tonight. See how well that lands.
Nah, no kidding.
No kidding. Chelsea's like, nope. So it's just all this stuff that is thought through strategically, intentionally to really move the needle is what we do, and then it becomes, like I said, that's what's cool about our training. And again, as a person, it's like, and I just get to see it every day. That's why I get to see the impact it has on people, right? And when you get to see how grateful employees are of when this kind of training is brought in, they're like, hey, my company gives a shit about me as a dad, as a mom, not just as a plumber, right? And they'll run through the wall for you, And like I said, then they're like, hey, can my wife do this? Can my son do this? And that's when you're tapping into something, So we're just trying to get it out there.
Yeah, absolutely, man.
Well, good stuff. Any other parting thoughts? I know we're kind of coming up on time, but it's awesome to get to learn more about the industry and bring this solution out there. And
my parting thought is this: like, claims are not going to go down. This world, this country is not going to get easier to live in for us, right? So we have to do something about it, or we have to be very, very comfortable with the consequences.
And that's what I tell people, like with integration of AI and all these other things, like that's from a mental health perspective. And again, I'll try to be succinct because I could talk forever on this, but I just always look at brains, right? And I don't care, male, female, what industry, like the brain of a human in this world, and especially our country. And we're just starting to scratch the surface on what is happening from a mental health perspective with how COVID went down, with the isolation, the fear, all that, that's like starting to kind of show its head in people's mental health, right? And now we've got AI coming in, right, and creating another underlying fear: is my job going away? Is AI going to replace me? So like, I've never seen more fear permeating a society and everybody. I mean, C-suite down to day one, just kind of living in this like constant worry, right? And if we as leaders and don't understand, we can't turn it, like I said, you can't just turn and say, oh, it'll hope it'll get better. It's not, so we have to do something about it, and we have to do something quick, and that's why we're talking with a sense of urgency, because I mean, we haven't seen anything yet to what can happen from a cost, claims, incidents, accidents. So, you either believe me or you don't. That's up to you, right? You either do something or you don't. Like that's on you, right? But our job is to just try to help and make it as easy and get out there and help people, because people are struggling, man. They are, and we want organizations to thrive and succeed and grow and do all that stuff that they want, but we have to meet them where they're at and bring some innovative things into the market and do it strategically through partnerships and relationships, and because it's not going to get fixed in school systems, unfortunately. I don't think it's not going to get fixed in the government. I don't think it's going to get fixed in healthcare. It's going to have to get fixed through entrepreneurship and strategic industry partnership. That's how change happens.
Absolutely, man.
Awesome. Well, I appreciate you coming in. We got a little gift for you, right, Chelsea, somewhere? We always have a little parting gift for our guests. We'll give that to you here. But thanks again, bro, for everything, jamming out, I have a feeling that there'll be other episodes here. So we always like to present our guests with a kind of a painting, from our local resident artist. And so this is this is a painting we're going to give to you here.
This is sick, dude.
Yeah. So we're on the Space Coast, so everything we do has a space theme, and so we kind of take in some elements that we know you're passionate about, so we got kind of Artemis launching up there, our astronaut, jamming out on the guitar. Got Bamo down there.
Hell yeah.
Corner. But that's our in-house artist, so hope you like that.
Thank y'all. Yeah, that's sick.
Put it on the wall.
Absolutely.
Yep. Cool, brother.
Thank you, man.
My pleasure.